Hello, my name is Latoya Strum. Today I will be presenting you Healthy Aging, Healthy Living, a community-based self-management program designed to improve population outcomes. Here you have the table of contents. Please take a minute to look over them. According to the CDC, chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living, or both. For the four of the most prominent chronic diseases are cardiovascular disease, cancer, COPD, and type 2 diabetes. Chronic diseases may significantly impair everyday physical and mental function and reduce one's ability to perform activities of daily living. The prevalence of chronic diseases continues to increase as our population ages. Today, many older people have more than one chronic condition. Thus, comorbidity is a problem for both the individual and for our healthcare system. Chronic diseases are the leading cause of death and the leading driver for healthcare costs. Disease rates from these conditions are accelerating globally and advancing across every region and pervading all socioeconomic statuses. Diabetes can cause heart disease, kidney failure, and blindness. Nothing kills more Americans than heart disease. Cancer continues to rise and is expected to reach almost 174 billion of healthcare costs by 2020. 1 in 3 adults are obese. 1 in 7 adults have chronic kidney disease. Risk factors of chronic diseases include poor nutrition, lack of physical activity, tobacco use, excessive alcohol use, and psychosocial stressors. A small group of modified behaviors and intermediate biological factors account for a substantial portion of chronic diseases. These modified factors are influenced and shaped by societal, economic, and physical conditions. Changes in health behaviors and biological factors have the potential to reduce chronic diseases significantly. For example, a tobacco-free society would prevent more than 90% of lung cancer deaths and 30% of all other cancer deaths. With healthy eating, regular exercise, and not smoking, up to 90% of type 2 diabetes, 80% of coronary heart disease, and one-third of cancer can be avoided. By making healthy choices, you can reduce your likelihood of getting a chronic disease and improve your quality of health. Many many risk factors contribute to more than one chronic diseases. In rural communities, manufacturing influence health. Rural communities experience a higher prevalence of chronic conditions than their urban counterparts. Rural communities also experience higher rates of mortality and disability than urban communities. Limited access to health promotion and disease prevention programs and healthcare services contribute to these healthcare challenges. Higher poverty rates, cultural and social norms, low health literacy, educational disparities, limited affordable reliable transportation, unpredictable work hours, low population densities for program economics, availability of resources, and lack of access to healthy foods and physical activities are many of the barriers that individuals in rural areas face. Although chronic diseases can occur in all three levels of prevention, the focus of healthy aging, healthy living will focus on tertiary prevention, as the plans are designed to help people lead a productive and satisfying life by maximizing the use of remaining capability. Tertiary prevention strategies are implemented during the middle, late stages of clinical disease and refer to measures taken to alleviate disability, restore effective functioning. Attempts are made to slow progression or to cure the disease. Tertiary prevention aims to soften the impact of ongoing illness or injury that lasts that has lasting effects. This is done by helping people manage long-term, often complex health problems and injuries in order to improve as much as possible with their ability to function, their quality of life, and their life expectancy. Chronic disease management can occur through many different programs. Healthy aging, healthy living is a self-management program designed for individuals with chronic disease with physical, mental, and psychosocial support. The primary tool for implementing a population strategy of prevention is a community-based program. Community interventions use education or environmental changes to promote and facilitate lifestyle and behavior changes needed to address a particular problem. Workshops are facilitated by a DNP nurse and one trained leader who is not a non-health professional with chronic diseases. Trained volunteers and community leaders. Healthy aging, healthy living classes will be given for 2.5 hours once a day, twice a week for 8 weeks in a community setting such as a senior center, library, community center, or churches. People with different chronic health problems will attend together. Subjects covered will include nutrition, exercise, healthcare, and mental health. DNP nurse will use learned skills to act as an advocate for resource efficiency, cost-effective, and quality care. Liaisons effectively between various parties in efforts to improve healthcare. The role of the DNP will also include identifying the target population and their key health needs, involve passionate people in all program aspects, assess staff capacity, seek and maintain support from partners, and facilitate administrative support for the program. The DNP nurse will use leadership competencies such as liaison, communication, and interpersonal skills to facilitate through the Healthy Aging, Healthy Living initiative. Success measures will be determined by interviews, surveys, focus groups, observation, and progress checking. The data will be collected at the beginning and end of the program. Participant data will include demographics, biological marker, health statuses, medical history, and knowledge. In conclusion, with the success of healthy aging, healthy living, individuals with chronic diseases will be able to effectively manage their chronic diseases, thus decreasing the number of rehospitalization, decrease the cost of increased health care, and also put rural areas, decrease the advantage in rural areas. The ultimate goal is to live a safe, productive lifestyle. And healthy aging, healthy living will provide this opportunity.